we have a pretty full lineup this morning, so I didn't want to take up a lot of time with updates at the end of the meeting. I'm happy if anybody has any questions, or because there's a lot of new people on here, questions or comments or need more information, I'm happy to hang out a little bit. But I do want to get to the meat of our program, which is transportation. But in the last month, things that are still going on for the Peak to Peak Housing and Human Services Authority is moving forward on the multi-jurisdictional housing authority with Gilpin. They put out an RFP for the consultants to help with that project. That's moving forward. I attend the Mountain Coalition for Youth meetings. We have some amazing youth in town, and they're doing some great stuff. And I'm hoping that we can move on that. Sorry, somebody needs in the meeting. And the Nederland Comp Plan, I have been on the steering committees, or I don't know if they call them work groups or steering committees, for housing and human services as the Nederland Comp Plan builds out. And then the transportation multimodal plan is also reaching its kind of final stages, and was happy to sit on that steering committee as well. So a lot going on in Nederland. What affects Nederland affects the region. So I hope people are keeping up on everything. If you didn't get a chance to listen to the last BOT meeting, and I think it was the meeting before, Miranda gave a great what Nederland's accomplished kind of in her tenure, and it's amazing to listen to. So if you have a chance, you should do that. It was her last meeting that was there. Tom, are you in?
I'm in now. I was the pointer went to Google, so I found the Zoom over here.
Thank you. And then just really quickly, I do want to introduce Tom Holwald, who is our new Peak to Peak chair. He was voted in without his presence last month, as we're apt to do in this community. And I'd love for him to just say a few things about yourself. We have a huge presentations today, Tom, so I was trying to leave a lot of time for that.
I'll be fast. Yeah, Tom Hold came from Nederland Board of Trustees, Planning Commission, and then and I've done a lot of regional stuff on the DRCOG board. Been on the food pantry board for about a year, been board chair for about a week. And Miranda suggested that I take a look at this one, and I just laughed at her and said, I don't think so. But by Saturday morning, I called her back and said, let's talk, because there's so much to be done. We're not just in Nederland, but just across the region. So I'm excited to be here, and let's get on with the agenda.
Great. I'm having a feeling like people might be.
I have a feeling that they might be over at the other link. I'm not sure how I got the Google Meet link.
Well, I erased that, but I'm hoping that people realize that.
The link that you sent was correct, but the meeting code to get in differed from the one that I had on my calendar that I put on some time ago. I
don't see anybody trying to get in. There's no waiting room. I will research that while Lisa Bitzer with VIA kicks us off.
You ready for me to do my thing?
Yes, if you're ready.
I am ready. Let me see, share my screen.
Let me make you co-host really quick.
Okay.
All right, as soon as you should be able to do that now.
Now if it'll work, okay. I don't know why you see two, there you go. Can you all see me? All see my screen? Okay. Good morning, everyone. I'm Lisa Bitzer from Via Mobility Services, and I'm just gonna do a short presentation of our Family and Friends Mileage Reimbursement Program. We don't have paratransit service up in Nederland. We do the mountain ride and this Family and Friends Mileage Reimbursement Program. So how it works is that people can go ahead and call our mobility specialist anytime, Monday through Friday, between 8 and 4:30, and it's at this number you see right here, 303-444-3043. Or you can email them. This current presentation is on our website, so at viacolorado.org. You can get it and you can download it. But basically it is to reimburse people who can get a loved one, family member, friend, neighbor, that can provide a ride that VIA cannot. And so it's designed to increase your transportation options. Registration is required. So you need to call the mobility specialist, get yourself into the system. All trips must be entered prior to the trip date in our system once you're registered, and you can schedule up to 30 days in advance. And so how you register, again, call the mobility specialist. And you just can basically, for the Ned area, you can just tell them that you want to do a family and friends registration and reimbursement. And it doesn't take long, it takes about 5 to 10 minutes. It just depends on what questions are going to be asked by the person that is registering. Few things that we need: name, home address, phone number, mobility status, whether you're ambulatory, use a wheelchair, walker, whatever, ethnicity, date of birth, and a couple of other things, but it doesn't take long. Once you are registered, you're good to go. And after that, you can call the call center, and that's that number, 303-447-9636, anytime Monday through Friday, 8 to 4:30. And a reservationist that answers the phone, and we do have bilingual reservationists and English speaking, can go ahead and they'll put that trip. You just tell them, I want to book a family and friends trip, and they'll say, okay. Then how you get reimbursed, we can do direct deposit, and that is the preferred method, or we can send you a check in the mail. The reimbursement rate is 50 cents a mile. The maximum reimbursement for each one-way trip is $12.50, and the maximum reimbursement amount for a month is $100 with all trips combined. A direct deposit or a check would be mailed to you within 15 days. Additional forms will be sent to you, or you can print one out, because once you're registered, you put the trip in with us, we send you a form, you put the trip on the form, you fill that out, and let me show that. There we go. Once you get that, then you go ahead, you put the date of your trip, the start of the trip, what's the address, destination, trip purpose, the driver that took you, their phone number, round trip, one way, and the total number of miles. You go ahead and submit this at the end of every month. And then we go ahead and we issue you a check the beginning of that next month. Quite simple to do. We have a lot of people. In fact, last month I was looking, we had 12 people up in Ned, 12 trips that were sent family and friends. So there's some people using it, which is a good thing. Just a way to be able to get around. You're welcome to do with the money whatever you want. You don't have to give it to the driver if you don't want to. You can keep it for yourself. It's the amount is made out to you. What you do with it is strictly your business. If you want to have the ability for our website to speak to you, basically be a screen reader. If you do mobility specialist with a capital V, capital C, it will speak to you. And so therefore you can listen that way. And it's pretty simple. That's about all that there is to it. Does anyone have any questions?
Would something like mountain rides or peaceful rides be eligible?
Yeah, so anyone up in Netherlands, any place where we serve is eligible. So if someone's using Mountain Ride, but they also want to do family and friends, that's great. If they're doing family and friends to use Mountain Ride, that doesn't quite work that way.
Okay,
It's
I
to
was
be able
thinking
to, you know, take you
Mhm.
around town, take you down to Boulder, maybe you have to go down to Denver for a medical appointment, you know, something like that.
Okay, I was thinking of, and I'm sorry, I misspoke, peaceful rides, you know,
Christine, I don't know because he's he gets paid. He charges. So I don't know, Lisa. I mean, if
Yeah.
that would qualify.
Yeah, that probably would not qualify. It's another
He's more of a
company
taxi.
performing a trip. This is for, you know, you got a family member, loved one, neighbor, that's willing to do it. That's basically what it's for.
And I do want to stress, it's not, what are the requirements, Lisa? They need to be, the registration, they need to be disabled or not have a car or.
Now, up in Ned, it's open to the public, because it's rural, so anyone up there can use it. If you live in Boulder County, or places that are urbanized, then you would have to be 60 plus and or have a disability. But any place that's rural, it's open to the public.
I think that's key. I mean, I think what we're looking at today are options for Nederland transportation, which there are some, and we haven't really educated ourselves on it. The fact that this is open to anybody because we're rural, I think is really important to remember. It may not sound like a lot of money because we're 20 miles away from anywhere, but so it eats it up pretty quickly, but any little bit helps. And if somebody needs a ride and can offer this as a incentive for someone near them or close to them, I think it's a great way to go, especially for, you know, we have doctor's appointments, even in town. I would love to see more people being able to use it in town.
Yep.
And then I also would love to see more outreach. Well, we're doing, never mind. That was it.
Okay. And do you want me to talk about Mountain Ride now? And
Yeah, if you want to talk about VIA and mountain rides, and then I just want to give show a little thing.
please stop sharing.
Unless anybody else has any other questions about friends and family. If you are
Darlene
a
has,
service provider and people are having a problem getting to you, have some registration forms, give these to people so that they can see that there's an option, please.
Katrina,
Yeah.
Darlene had a question in the chat too. Is the entire peak to peak region considered rural, like Allen's Park, Raymond, Riverside, Ward, Gold Hill, Jimtown?
yeah.
Yes, it's all considered rural.
Cool.
Okay, is it Boulder County only?
No, any place that VIA serves. So we're
Okay.
in Weld County, parts of Weld County, Boulder County, Larimer County, and the Denver Metro.
The
About
question
Gilpin.
was, do you serve Gilpin?
Yeah.
Yeah, no, not Gilpin.
Okay.
I had one quick question regarding the pay, like people that have to pay for rides, like peaceful rides. If they're a senior paying for a peaceful ride, can they get friends and family reimbursement to go towards what they pay for themselves for the peaceful rides or a paid ride?
So you mean that they're like having a company take them somewhere? Then no, this is strictly
Okay.
for, it's not meant to be a reimbursement to pay another company to take you somewhere. It's reimbursement for family, friends, loved one, neighbor, someone like that.
But even in the mountains, when maybe someone doesn't have the option of family or friends and they have to pay for someone to pick them up, it couldn't be necessarily towards going against their cost in any way.
We send them the money. What they do with the money is up to them, right? I mean.
Oh,
we-
for the client,
to
like the
client.
actual,
We send the
per-
money to the client. What they choose to do with that money, that is totally up to them.
so realistically, they could use it towards if they're having to pay for transportation if they wanted to get themselves to medical appointments and things.
They could. What they, like I said, what they do with the money is totally up to them.
Okay. All right, I think that answers it.
But I think, Reba, what I'd also like to do is just reach out to the community and let the community know that that this is available if they know of somebody.
Yes,
Because a lot of times people don't want to ask.
right.
Sure, yeah.
So if we can reach out to people who are caretakers, caregivers, and in those areas, that's kind of the goal of moving transportation and these options forward in the community.
Yeah, that would be fine.
Cool.
Thank
Any-
you.
Questions? Okay, I'll switch over to the mountain ride. It's going great. I was just looking at some stats. We average anywhere from about 12 to 17 riders, each day that we do it. It's on Wednesdays and Thursdays. Sometimes a little less, but sometimes a little more. So it's doing really good. And so far this year, we've done 430, we have had 433 riders, which is great. Those are great numbers. And I'll let Katrina go ahead and add where those people are going. She has that and where they're wanting to go.
I just wanted to know where people are coming from. This is from January. So it's where people are being picked up at, which is the RTD Park and Ride and the Ward Food Box have the biggest pickups. And then the shopping center, and people are being dropped off at the shopping center and the community center. So you can see we're moving people to where they need to go. And I hope this relieves a little bit of pressure on the Ward Food Pantry because people are able to get to Nutterland to shop. Also, we see people coming to the community center, but I also see people using it so that they don't have to ride up hills, you know, back and forth from the post office. But I just think it's interesting to see this in terms of where people coming to and from. So it's definitely doing what I was hoping it would do. So.
Yeah, and I see a question, is 433 riders unique riders? No. I'm sure we have duplicate riders that ride each Wednesday, each Thursday. So they're not unduplicated riders. They're just how many riders rode that day. Yes, go ahead.
Sorry.
Hi, good morning. I am from Mental Health Partners. I'm up here with Clinica. I'm speaking more so on behalf of Clinica right now. I asked them if they wanted me to touch base about this specific subject. The only thing that we're wondering is, how do you go about getting a little more time of stops or pickups when it comes to Rollinsville? We tend to, at our clinic in Ned, at the Clinica here, are seeing that there are a good amount of Rollinsville people who, once they get in and they're getting picked up, only have about 30 minutes to be able to be in town, but we don't take afternoon appointments until about 1 p.m., 1:30. So we're wondering, how do we make another either drop off or something where we have a little more time so people from Rollinsville can actually have an appointment? Or Clinica is thinking about moving to change their schedule around to accommodate. So I'm wondering if I can get you connected with Siobhan Hoyle or someone to maybe do a little bit further about that. I'm just playing messenger right now.
And I did talk to Siobhan, And that's when they decided that they were kind of maybe just going to shift their hours. The other thing that Siobhan and I talked about, Dr. Hoyle, who's the doctor there,
Yeah.
for anybody that doesn't know. The other thing is you can ask the driver to drop you off at the front, so they don't have to walk from B&F, which saves a little bit. And I've let Siobhan know that. I do know that timing is tricky.
Mhm.
And I think we can look at it. We're going to be reviewing things here now that it's like 6 months into this year. So definitely we can take that into account. We know how important it is for people to get there.
Great. That would be amazing. Thank you. Just, they've got a pretty tight schedule and it's pretty crucial that they try to stay on track. So we're just trying to finagle it and figure out what the best motive would be. But I'm glad you guys are still in contact.
And I'm glad you said something too, because it's both of you now. So maybe we can just
Yeah.
look at how that goes. I wasn't aware of your appointments. Maybe you could email that to me so that I have that on record so we can use that to look at.
Okay, I can ask her
Just
to
to
do that.
remind
Sure.
me. Yeah, I won't remember.
All right. Thank you.
Thanks. Anyone else?
Hey, Katrina, I have a question. I can't figure out how to raise my hand because I haven't been on Zoom in so long. I'm always on Teams. So obviously, I'm coming from like the more of the emergency management field at this point, but I'm curious if this vehicle if there's a possibility of this vehicle being used, if there are evacuations, if we're in kind of that warning and not order stage, or what used to be called pre-evac to get people out. Is that a possibility, Lisa?
Yeah, great question. So VIA is a second responder, sometimes a first responder, depending on what's happening out there, fires, floods, cold, you name it. And so it wouldn't just be that vehicle. It could be any number of vehicles in our fleet. We have everything from 8-passenger to cars to a 26-passenger body on chassis buses. And so whatever is needed, we work with the Office of Disaster Management. They changed their name, Disaster Management. And we go ahead, they let us know where to go, where to stage, how to do it, and we do it. So yeah, if something happens, I would say reach out to the Office of Disaster Management. And then they have the hotline to us and my team, and then we have buses ready and deploy where they tell us to go. And it's important that we go through those steps because they let the police know and we're able to get through barricades that other vehicles would not
Awesome.
be able to do. And so it's important to follow the right protocol, so that once we get up, we can come in and out as we need to, where they wouldn't allow other vehicles to do so. So, yeah.
Definitely.
More than happy.
Okay. Thank you. And I know like that VIA helped during the left hand Calwood fire. Sorry, I'm Malamute. I guess like part of, there's some people who may choose to leave if they're kind of in that warning period because they may have additional mobility challenges or whatever. And so I was curious if that would be an option too, that we could obviously request through the ODM to kind of get people out if it's before that, hey, get out right now, evacuation order.
Yeah, anything's possible. I'll give you a
Awesome.
perfect example. After the Marshall wildfire, Balfour down here in Louisville moved all their people into their facility and then their pipes broke. And so they called us, which wasn't through the disaster management. They called VIA and said, hey, we have to move a ton of people out and move them into another one of our facilities. And we got drivers and vehicles ready, and all day long we moved people. So just so everyone knows, we do not charge a cost for this. This is something that VIA does to be a community partner. Sometimes we're lucky where if it's an unfortunate disaster and FEMA money is available, we can get some of that. But other than that, we do not charge to come and move people. We take pets. If it can fit on a bus and be okay, we'll move it. We've done dogs, cats, mice, rats. One lady asked me, would you do a goat? And it's like, sure, if the goat will get in the bus, sure, we'll move a goat. Yeah, whatever we can to help. And then be able to get them set up with like the Red Cross or whatever they need once they get down to where it's safe. Into a facility or we can cover ground like with the Marshall wildfire. We move people all the way down to almost Colorado Springs because that's where the sister hospital was that could assist. Yeah, we can cover some ground.
Thank you so much.
Any other questions for Lisa? All righty. I want to acknowledge Jessica, who is our person from Mobility for All. We're going to move into RTD, but Jessica Vienna is our facilitator for the Mountain Mobility Work Group, and those are open to anybody who wants to come. They are for when they pop up on my calendar once a month and I go.
Hi, good morning, everybody. Apologies for being a couple of minutes late. I was preparing for the meeting and then I realized that it was time for the meeting. So my name is Jessica Villena Sanchez. I work for Boulder County. I'm with the Mobility for All program. This is a mobility management program that really helps people connect with transportation resources. I help Katrina and Angel Vaughn, who's my boss, plan this meeting, and we talked with the providers that are going to be presenting today. Mobility for All organizes and hosts monthly meeting that focuses on looking at the needs of mountain communities when it comes to transportation. I can put the link here in a little bit. If anybody wants to join, it's open to stakeholders who would like to learn more about, for example, if they have clients or if they work with specific groups like older adults or people with disabilities, we can help them get connected to the resources that they need. So yeah, that's me. And thanks, Katrina. If you want, we can move on.
Yep. And Mobility for All has been good about kind of sussing out some of the issues we were having with transportation and then realizing that we needed to focus on what was available here in the mountains and make sure that we're communicating that. So that was the impetus for this group. So now we will go to Gretchen Vindigar with RTD. Thank you so much for coming. Welcome. And we see the Access-a-Ride vans in Netherlands. So it's great to know that we have that option. But I think a lot of people have questions about what it is and how to do it.
I have a presentation if I could share. I have to figure out how to do that.
I made you co-host.
Yeah.
Okay, I'll share. There it is. All right. Did it select the right? No. Let's see if I can get the right screen. Are we there? Can you see?
Yes, we see your Access-a-Ride slide.
Okay, there we go. All right. Thanks for having me today, everybody. It's great to hear some of the other options and potentially some places that are some options for partnering for our service. I want to first review what Access-a-Ride is. It is shared ride service. And it is comparable transportation that is required by the ADA for individuals with disabilities who are unable to use fixed route transportation. And we provide that service for those that have a disabling condition that prevents them from using fixed route service that's not commuter service, some or all of the time. So it is a service that's not based on income, and it's not based on the presence of disability, but how the disability interacts with your ability to use a fixed route bus. And it's shared ride, scheduled 1 to 7 days in advance. Most of the time we are able to provide door-to-door service within 3/4 of a mile of the fixed route service. And we'll talk about that next to discuss what that is. So our service area, and I have a photo of it here, and this is most of it. But this is the area that we can provide transportation. This is the ADA service boundary, 3/4 of a mile from the fixed route non-commuter bus service. This does vary day to day and at time of day. So there are some days where there's more service, some days where there is not service. And on our website, we have a couple of lookups that you can use. One is the map that you see at the top of the screen here. The other is our service area lookup, where you can enter your address directly and the time of day that you want to travel, and it will tell you if service is available for you. When we talk about service areas, we do not mean that you have to live within our service area to be able to use our service. And that's something that is commonly a misperception for folks. If you are living within, as long as you can travel to this service area, we are able to take you as long as you're within our ADA boundary. So it doesn't preclude you from applying if your home address is not in the service area, but you may need to have, to use some of the other options available to get you into the service area. So once you're there, then we can pick you up and take you, especially if you're traveling, into Denver, into Boulder, wherever you need to go, so that we can facilitate that. We also will help you identify the places that are closest to your home that are safe for pickups. And we typically try to choose public spaces where there is shelter in case there's, a delay in the service, so that there's a safe place for people to be picked up. And then when possible, you can also, if you need help with identifying that, if it's not your home address, if it's somewhere else that you're going, we can always facilitate that for you as well. And then we have our Access on Demand service, which we'll talk about later. And that is also dependent on the availability of drivers in the area. So I know that that's sometimes an issue in the mountain region. Our eligibility for our service is determined on an individual basis. So we we're looking at an individual's ability to use fixed route service. And that includes their ability to navigate the system independently or travel to a stop independently. We do expect that as a first-time applicant, you will be participating in the full assessment. And that includes, an in-person trip to our offices. And then just a reminder that for folks that may not be able to sign for themselves, we do need someone to agree and sign on their behalf regarding those, the consents that are on the application form. So our application form is found if you navigate on the RTD website to Routes and Services, and then to Access-a-Ride and How Do I Apply. Then you would select the new customers option, and the application forms are there. There are 4 components to our process. It is a written application, a medical verification form, an in-person interview, and transportation assessment that take place at the same time. And that, you know, the applications are available online, or you can call our administrative office and we can mail those. And there was some interest expressed about having, you know, multiple applications sent for different providers in the area or for different agencies in the area. If you call our office and request, you know, 15 to 20 applications, we can certainly send those to you if you're interested in facilitating someone's participation in the service. During that certification appointment, you will review, the assessors review the information that's in your application and your medical form. If there are any questions that come up from those answers, those questions are discussed and trying to clarify one's needs and one's abilities. Individuals are taken through several different steps to just assess in greater detail what kinds of needs there are. There are some basic things that we try to take everyone through. There's a street crossing, stepping up and down a curb, managing a curb cut, those kinds of things that are common needs as you're traveling in the community. You need to be able to manage those things. So those are things that are examined. And then the basic information about the service is reviewed. So how to schedule a trip, what the fares are, the process for, you know, making a reservation, those kinds of things. And this takes place in North Denver. We do provide transportation to this appointment. And again, for members of the community that might be outside of our service area, we will work with you to find, you know, a location that we can pick up from to provide that transportation. Access-a-Ride tickets are available via King Soopers or Safeway, the mobile ticketing app, or through our website. You can purchase tickets. Local tickets are $4.50 each way. That is a recent reduction in fares starting January of this year. And then to travel to DIA, it's $19. Fare is expected prior to boarding, and we do not make change. So if, you know, the drivers just don't manage the change. And then if you travel with a personal care attendant, that person would not pay a fare. But if you have a guest that's traveling with you, that fare would be expected. And then for those who are eligible for the low income program, the LIVE program, that started on March 1st of 2024. That's a 50% reduction from the regular fare. So that's, and that's something that's applied through the PEAK website through the state. They handle the applications for that. Once you are an eligible customer for Access-a-Ride, you are also eligible to enroll in our Access on Demand program. It is an optional service that is curb-to-curb transportation and not required by the ADA. Access-a-Ride customers are eligible for 60 trips, one-way trips per month on one of 4 services: Lyft, Uber, Metro Taxi, or Z-Trip Taxi. And you can opt into one or all. The $25 subsidy applies for trips taken within the RTD boundary. And you must complete an enrollment form to be eligible to use the service. We have to be able to collect your information that's in your apps so that we can then share that information with the provider to say, hey, this person is our customer, please apply the voucher or Lyft Pass to their account. All the trips are scheduled for Uber and Lyft all those trips are scheduled through the provider apps. Metro Taxi and Z-Trip Taxi also have apps, but we have a call center booking mechanism for those trips as well. And then for those that use wheelchairs, we have wheelchair accessible vehicle service through Uber and Z-Trip. And there's more information on our website about that service. Any questions?
Sorry, I'm going to jump in really quick. What is local? Does that include Nederland? Is Nederland to Boulder local?
Yes, actually, we only have one fare anymore. I just realized as I went through the slide that I had local there because we used to have the local and regional fares, but now all of our trips are $4.50 each way.
Great. And the LIVE program, I don't know if we can go into that, but if somebody is applying for the state services through the PEAK website, I wasn't quite sure what that covers. That just gives people some other transportation options in.
So the LIVE program has been a part of RTD for the last couple of years for regular fare products. It has only since March has applied to Access-a-Ride, and when they redid the fares, they provided, or they leveled out all of the discount programs. And so the 50% discount applies across the board for that program now, and now to Access-a-Ride. So that's very new. We have a lot of customers that are, slowly applying for that program because it now benefits them to do so. Because before Access-a-Ride, it didn't apply. So if someone is already receiving those state benefits, they just need to go into the PEAK website and select the LIVE the transit benefit, and then they would be able to add that. Every day we get a report from the state telling us who is now eligible. And then if they're already our customer, we add that to their profile. If, they're a new customer, if someone's coming in with PEAK benefits already or LIVE benefits already, we just ask them to bring their LIVE cards to their assessment so we can get that documented and make sure it's reflected in their account.
Great. And that was the word I was looking for, state benefits, somebody who was already getting benefits. It's an easy, you could do it with that program.
Yes.
And then the other thing I do want to point out is we do not have Uber, Lyft, or taxi up here, which is hard. Can somebody use it if they make it to Boulder where there is a Lyft or
Yes.
ride? So if somebody was able to get to Boulder, they could use the Uber or Lyft service there.
Yes. So it just is based on driver availability. And, again, the fares also with their algorithms, sometimes you will have a nice short trip that's within the $25 subsidy, but if there's few people or lots of people asking and fewer drivers, that trip may cost a little more. Yeah, so it's not perfect. Even for those that are in areas where there are more Lyft drivers and Uber drivers. So, and we had one other thing I wanted to add is that the question was asked when we were planning how many people in the region are Access-a-Ride eligible or are using Access-a-Ride currently. And it's a very small number. It's less than 50 people have applied for Access-a-Ride and use it. And many of them haven't used it recently. So, it is a service that is available, especially if you are traveling beyond the peak to peak region. It's very affordable if you're taking a trip into downtown Denver, into Boulder, where you're needing, where you're traveling, and can hopefully get into the service area if you are not within it. But yeah, I think it's something that, more people could take advantage of if we were spreading the word a little more. Any questions? Any other questions?
There's one in the chat asking if you'll share your presentation.
Yes, I can share it.
And what I watched, and Jessica also put a link in the chat to the Lunch and Learn with Mobility for All last year. And I watched that and I found that as a great resource for people who want to reach back. She goes into much more detail about different aspects of Access-a-Ride. She had more than 15 minutes there.
Yes, she did. No.
So yes, I highly recommend, and the chat will go out to everybody after as well. So, any other questions?
This is Annette. Hi. I just want to clarify that when you said that less than 50 individuals applied for and actually use this in the region, you meant the whole RTD region, or just are you breaking out the peak to peak area?
Peak to peak. So the question had come to me, how many people are certified and eligible to use Access-a-Ride right now in our area? I had no idea. So I did a zip code analysis and it's not very many. And it's hard to know if it's a misunderstanding that it's not available for use. We do have a couple of people who are newly applying and one who is newly certified and using it with some regularity. So that's nice to see. And then someone else is pending their assessment. So we're definitely, hopefully seeing an uptick based on some of the communications that we're doing.
Cool. And do you have a way to identify the number of those who've applied that don't use it? Like you said, 50 people applied, but how many? I don't know if you can break it
50
into
is an
that.
approximate.
Right.
I didn't look through everybody, but I did find several that have eligibility and have not used the service recently. I did find one who had passed away. I did find, and then I found these few that are newly certified or pending a certification that are hopefully going to be, more regular users of the service.
That's
That
cool.
was the
And
first
more of
slide that
those
we
people.
saw that maybe we weren't supposed to see.
I'm sorry?
I think that was the first slide that we saw that maybe we weren't supposed to see, that informal report.
It's okay. Something popped
As
up
you
when
were
you were
as you were
sharing.
booting up your,
Oh, I don't know.
and then my last question is, out of the whole service region,
Mhm.
roughly how many people hold that, use that service?
We have about 13,000 customers.
Okay.
Throughout the Denver area, just over.
Thank you.
Mhm.
And I wanted to say real quick, I think that next month's meeting is going to be in person, right, Katrina?
Oh, yes, the peak to
In
peak
July,
meeting.
the peak to peak, yes. So I think we had talked about us going to this in-person meeting to help people with any of this, providers. And if they have any other questions, specifically if people are interested in Access-a-Ride, we can bring some signing sheets and walk people through the process if they're interested in that. So I think Mobility for All will be present at next month's peak to peak meeting in person.
Did we talk about doing it at the Human Services Fair or the?
Oh, yes.
Because I think the peak to peak meeting, it's a great place to hand out this stuff, but we don't always, and it would be great if you came to that as well to help providers, the people at that meeting. But I think if I advertised you a couple of months coming to some Human Services Fair.
Yes, and that's at the end of this month.
Yeah.
Right. Okay, so that's the one.
Yeah.
Yes.
I just wanted to chime in that, Mobility for All is planning on being at the resource fair at the end of the month. And we're also going to have people there to talk about the business and residential pass programs. So
Great.
there's going to be plenty of resources.
Okay, well, I just wanted to say also, I'm gonna reply to, if someone else could share, I'm not able to share it through Zoom, share the link, but I will reply to the email and send it, so please share. And unfortunately, I'm gonna have to leave after this meeting right now because I have to be somewhere else, but I appreciate everybody's time and attention, and thanks for your help.
Thanks so much for coming.
All right,
Appreciate
take
it.
care.
Thank you, Gretchen.
Mhm.
And now we're on to non-emergency medical transportation. TransDev, formerly IntelliRide, which some people might be familiar with, but Kimberly, do you need to share the screen? Do you need something?
Yeah, actually, I am the general manager, Kimberly Johnson, and I have Joshua Lewis on as well. He's our call center manager, and he is going to be sharing screen and showing our website as I go through the information.
Ooh, what was his name again? Sorry.
Joshua Lewis.
Oh, there he is. Share screen.
Hello. Okay. So, and I apologize, I do not have a PowerPoint or presentation to share. This was my first meeting we came to, so I was not prepared, but we are going to share screen and show you guys the site as I go through the information. And we are going to put the link to the site in the chat here so that you guys have that as well. So again, I am Kimberly Johnson. I am the general manager for our TransDev Health Solutions office, formerly IntelliRide. I have been with this company, TransDev, for 10 years, but I've been in the NEMT business for almost 30. Very passionate, love what we do, love being able to help members with that barrier of getting to medical care. So first of all, just right out the gate, what NEMT is non-emergency medical transportation. For us, what that looks like, we are a brokerage that works and is hired by Health First Colorado Medicaid. So the client base that we serve are Medicaid eligible members who are currently eligible for Medicaid and do not have other means of transportation. Although we do have a mileage reimbursement program that I'll chat about, differs in some ways from what Lisa talked about, but I'll give some information on that as well. So then moving on to who's eligible for NEMT, as I stated, it would be any Medicaid eligible member who has a state Medicaid plan. The reason I point that out, there are some particular waiver members and other different types of Medicaid plans that do not qualify. So essentially when anybody calls us inquiring if they would be eligible, we use the PEAK system and we verify their eligibility, ensure they have the Medicaid state plan and that it is currently active, and then we can go from there and assist. So again, we are the brokerage hired by Health First Colorado, so we are bound by Medicaid guidelines. So often we will get members asking, how come, TransDev rule is this or it's that? We strictly follow all the Medicaid guidelines. That is in our contract, and that's what governs what we can approve and authorize for transportation. So best way for people, we do have a lot of members that have limited tech skills and sometimes limited cell phone minutes. However, right now, we do have a few ways you can reach out to us to request transportation. First being, you can call into our call center. We do operate Monday through Friday from 8 a.m. to 5 p.m. Mountain Time. Outside of those hours, we do have urgent after hours for things such as hospital discharges, or if somebody's waiting for their ride and it hasn't shown, but they cannot set up new transportation after hours unless it's a discharge. And so we basically are staffed 24/7, 365. But again, outside of that Monday through Friday, 8 to 5, it would just be for inquiries about where their ride is or if it was a discharge. So best way to get a hold of us, again, they can call, and we have those numbers listed there on the site. And we also have a MedChat feature where they can click the chat option on our website. And it is very user-friendly, not difficult at all to manage through. It'll prompt you what you're chatting in for. Some of the options you can go through our chat bot, meaning you're not actually going to speak to a live representative via chat. You're just going to answer the questions, and the chat bot's going to document the information. And there are some features that, like I said, if you don't want to take the time and go through a representative, that you can use the chat bot for. Otherwise, you would connect to a live representative, and then they would chat through and assist you. Same as being on the phone, just using the chat. We also have an app that they can download onto a cell phone, and we have web-based, our website as well, and self-service is web-based also, or it could be done through the app. So our members do have that option as well. I will say, I feel personally that MedChat, the MedChat chat online feature is a bit more user-friendly than the self-service. And after years of doing this and just communicating with our members, I feel like the MedChat is the better option if it's somebody who is not very tech savvy. Self-service isn't extremely difficult, but there are a few more features on there. And we have been working with our software program folks in improvements over the years on that as well, just to make the self-service portal as user-friendly as possible. But those are the methods to reach out to us. Transportation providers, this is what we offer. We currently, our brokerage area that we are enlisted by the state for includes the counties. It's a 9-county area currently. It includes Adams County, Arapahoe, Boulder, Broomfield, Denver, Douglas, Jefferson, Larimer, and Weld counties. Now, in those 9 counties, we can arrange transport. Our transportation levels start at public transportation, which is, fixed route and Access-a-Ride. We have nothing to do with their Access-a-Ride eligibility. They need to be enrolled and certified to ride Access-a-Ride. Then they could call us, and if it is a trip that qualifies, we would then mail them tickets for Access-a-Ride or for RTD. So that's how that works. And then obviously members have all different levels of medical needs. We start with lowest cost per Medicaid guidelines, which is the bus route or mileage reimbursement program, which I'll give more details on in just a moment. And then it just goes up from there. We do have commercial transport, sedan vehicles up to vans, wheelchair lift vehicles. We do ambulance transport for BLS and ALS, and stretcher transport, as well as in some cases air ambulance. So it really just depends on the member's medical needs. We do have forms that are also on our website that are required for any elevated level of service. In other words, if a member calls in, and let's say the member is in the Denver area and their appointment, we have the Medicaid guidelines for riding the bus built into our software where we build the trips. There are a couple of factors that go into play, such as Medicaid guidelines state a member should not have to walk more than a half a mile to or from their bus stop. And so that's on the end that they're leaving from, as well as their destination end. So if we were to build a trip in our system and that trip would require the members to walk more than a half a mile to a bus stop to catch the bus, it will automatically override it for that trip. That does create a lot of confusion, because we'll get members that call in and say, why are you sending me bus tickets? My neighbor gets a ride all the time. And that's our explanation. It is tied into the RTD system. So if their trip is either not on an RTD route, or they have to walk too far to get to the bus stop, or they would have to transfer more than 2 times to get it from their pickup to their drop off, those are factors that would automatically override that. And at that point, that trip would then be eligible for just a commercial taxi cab or sedan pickup. And then from there, again, if they have medical needs that dictate a wheelchair or anything like that, we do have our level of service form, as Josh is showing on screen there. And that does need to be completed by their medical office. And then Medicaid guidelines state if the member, if it's medically necessary that they need a higher level of transport, that's the form that we use to determine that. There is a separate form if they are needing ambulance transport. There are more details required to arrange ALS or BLS transport. So that is another form, as Josh is showing you. Again, all these forms are listed on our website under Member Resources tab. So fully accessible, and they can either be filled out digitally and turned in, they can be faxed, or they can be scanned over. That information is located on the forms themselves as well. Or sometimes they're printed off by the facility and hand filled out and then faxed over, which is fine as well. So outside of the 9-county area, statewide for Colorado, we do offer mileage reimbursement program. So I'll talk a little bit about what that entails. For mileage reimbursement, our current rate set by the state is 47 cents per mile for the reimbursement rate. We also do offer lodging in some cases and meals reimbursement as well. There are some guidelines and stipulations to what qualifies for that. I can tell you in recent meetings with Health First Colorado, they are revising some of that as well currently. So coming soon, maybe some changes. As of right now, if a member has to travel greater than 4 hours one way to get to their appointment, they would qualify for meal reimbursement for that day, potentially lodging, if it's something that requires a stay there. So we have lots of people in rural areas coming to the Denver area, for example, for transplant services, things of that nature. So if they were required to be there for a few days for their appointment, then they could potentially qualify for lodging and meals reimbursement. For lodging reimbursement, we go up to $100.22 per night. The member has the flexibility to schedule the lodging they prefer. If it is less cost than that, they're only reimbursed for, yes.
Sorry.
Yes.
You've had a little bit of an echo and now it's a lot of an echo. And I don't know if Josh is in the room with you or if there's somebody,
No.
if you're using your phone and your computer or.
Nope, not using two of anything, and there is nobody else with a mic even remotely nearby, so let me.
Are you connected to two different devices? Like, are you using your phone for one and your computer for the other? Does anybody else have any other suggestions to check?
Does Josh have another computer, two devices connected?
We're not in the same location, we're actually in two different states right now.
And I'm muted too. Up until just now, I've been muted this entire time.
Yeah. Oh, interesting, because it's been a little bit and now it's been a lot, so.
Is it still echoing now?
Yeah.
Yes.
Maybe if I try connecting my phone, it'd be better. Let me.
Oh, Joni says to turn your volume down on your computer.
Yeah, that's exactly what I was trying to do. One moment.
Would Josh be able to share? Because he doesn't have any.
He doesn't have the echo.
Mm-mm.
No,
Is
I don't have
that
an echo.
better?
No.
No.
Nope. Not even better. All right. Well, yes.
The speaker volume, if you lower that, that might help. Not just.
Yeah.
Oh, you did that.
Yes.
Oh.
Yes. Not. Doesn't seem to be working. Give me 1 second. I'm gonna try one more thing here.
And you're not hooked up with a ear microphone.
I am not, but I am going to try to move a headset and see if that helps.
Is that any better? Can you guys hear me?
Great,
Much
perfect.
better.
All right. All right, great. Okay, so sorry, continuing on. So again, the 9 counties we serve, however, we do mileage reimbursement statewide. I was talking about currently the rates. Again, lodging is up to $100.22 per night. Again, we don't just pay out that flat $100.22. We pay up to that amount. So if they were to book lodging and it was $85 that night, they would turn in the receipts and that's what they would get reimbursed. If they book lodging that is in excess of that, they are only reimbursed up to that $100.22 a night. And then our meal reimbursement rate is $43.98 per day. And again, that is up to that amount. And they would have to turn in itemized receipts for that as well. So basically how it works, if they're requesting mileage reimbursement, the member would contact TransDev Health Solutions via one of the methods we have listed on the site and let us know that they're requesting transportation mileage reimbursement specifically. And then we check their eligibility and then we go in and we can build the trip. Obviously, all of our transportation does have to be to a Medicaid enrolled facility. That is another Medicaid guideline. So there are some times when members call in and they want to go to a facility, that facility is not enrolled, then we are not allowed to arrange the transportation to and from. And that again is the Medicaid guideline. Though that information is also listed on Health First Colorado's website, we do have a link to their site on our website as well. So if members want to look that information up. Then once they contact us and we build the trip in the system, we give the member confirmation numbers for those trips. There is a confirmation number for every leg of the trip. So going from their home to the appointment is A leg, and then their return trip home is B leg. Sometimes we have trips in between, like if a member is going a long distance while they're in perhaps Denver, to and from the medical appointments as well can be reimbursed. And then what the member does is take the confirmation numbers we give them, which is their verification that they did pre-authorize those with TransDev because they do have to be called in ahead of time. And then they document those confirmation numbers on their mileage reimbursement form, which is also listed on our website. And Josh can show you that as well. And once that form is completed after their appointment, the member then submits that form to TransDev Health Solutions, and then we begin their reimbursement process. At this time, we do send out checks. We are very close and have been working very long to get some direct deposit options in place. But it still will be optional because we do have quite a few members that do not have a banking account or other ways. We are looking at potentially getting some cards that we could issue out and issue the payment onto the cards, such as a lot of the prepaid cards that are out there now. So we will have information on our website when that becomes available as well. It is important to note that when doing the mileage reimbursement process, on the mileage reimbursement form itself, we do need a signature from the location, just approving that you did show up or verifying that you did come to your appointment at that location. So it's very important if that signature is missing from the facility, that reimbursement will not be processed. It will be denied. When we do have to deny a mileage reimbursement, the member is notified. Now, a bit different from Lisa's program, this money is not paid to the member themselves. It is paid to the driver. That can be a family member, a friend. In some cases, if members have their own licensed vehicle, we will give them mileage reimbursement as well. So there are some cases where the member themselves is getting the payment because they drove themselves to the appointment. And again, that is statewide, does not need to be in the 9 counties. Okay, couple more pieces here, and then I will open it up if there's any questions. For any additional or special provisions for residents who have to travel a considerable distance, there is a 25+ mile form that we have in place that is on the website as well. Again, Medicaid guideline. What it states basically, the Medicaid guideline dictates that a member can choose any medical provider of their choosing within a 25-mile radius of their home address. We will transport them to and from those appointments. Now, if a member has to travel beyond 25 miles, which is often the case, whether they live rurally or perhaps they have to go see a specialist or somebody that is further away, then we do require that 25-mile form to be completed and approved prior to us being able to arrange that trip. And basically what the form is for is it has to show that it is medically necessary for the member to travel beyond that 25 miles for their care. The rule is still that they need to go to the closest provider that is willing and able to treat their medical needs. So, and that form has the instructions on it as well. Now, recently the state updated that form, and we did let them know that they do not have the information on the form of how to submit that form back to us. So they are getting that updated now, and we should soon have the updated one with that information on the website. But all of our other forms do have our information at the bottom, and it's the same process with the 25-mile form. They would submit it to us. The reason that was left off the form, the state did let us know, is they are contemplating changing that process and potentially having those forms submitted in-house. So we are waiting to hear confirmation on that. In the meantime, they still will get submitted to TransDev Health Solutions for processing. And then we were also asked, how can stakeholders best support their clients in accessing the NEMT services? I think the best practice is utilizing the information from our website. Again, almost all questions can be answered on the website. The information is listed, but of course, reaching out to us directly if there are unique situations or additional questions. We do have an email address on there as well. That email address is checked every single day. So we are getting back to folks in a timely manner if they send in questions or inquiries through that email address. It is listed on our website, and Josh is going to put that information in the chat as well for you all. And then again, just making sure that they're utilizing the information on the website and also information on Health First Colorado if it's regarding some of the Medicaid guidelines. We get asked about that a lot and why the rules are in place. That information is listed on Health First Colorado's website. And then finally, we were asked if we have any outreach materials for the stakeholders to provide to clients about the process. We do have a new member brochure that just kind of introduces the NEMT program. That is located on our website, can be downloaded and printed off if they choose to. And Josh is showing you that now. And then all of our required forms, which are other documents we have, are on the website as well and can be referenced at any time. We are working on, but there was recently a pause because I will tell you that Health First Colorado is revisiting a lot of their Medicaid guidelines currently and some improvements. One of the frequent complaints we had are parents, single parents needing to go to an appointment and they do not have childcare for their young children. Typically, the Medicaid rule is we only transport the Medicaid member with the appointment and an authorized escort if one is required. And we have documentation for that. However, Health First good news, because I've been working many, many years that I've been doing NEMT on getting some of these changes. They are revisiting and making some adjustments to their policy about a child being able to ride with a parent to appointment if it's the parent's appointment and the child is not having an appointment, to help balance that need for childcare and such, and as well as infant bonding for young children. So we will definitely keep our website updated with any updates to that. That is still being discussed at a state level and decisions are being made. The good news is we are told there will be some improvements to that policy. So very exciting for me personally, because again, many years in this field, I know that's been a very big barrier in the past. So that's pretty much all the information that we put down to share, but I will open it up to see if there are any questions for anybody.
I want to point out, we went from kind of the easiest to the hardest. The NEMT is difficult and time consuming. And I've seen people, many of the people struggle so much trying to use this service and not use it, just even get through the signing up part of it. And this isn't a question, it's just, this is available. And if we can do anything to help people in our area to sign up, that encourages them to get the health care they need, or the mental health care they need, or all of these things, that's kind of what we're trying to do here. So I'm really, really interested for a future conversation to talk about what we can do to help people sign up, especially for this one. You know about some of these things way ahead. I don't know how ahead we have to do these things, but you can't do all this stuff last minute. So we have to kind of switch people's ideas of, I'm gonna have surgery on the 4th and I'm going to sign up for everything on the 3rd. So just kind of being aware of our clients and their needs, and our community and their needs. Sorry, that's it.
And that's a good point. Actually, we Medicaid guidelines do state that we require 48 hours or 2 business days notice to arrange transportation for any of our transportation levels. However, for mileage reimbursement, members may call the same day or the day of to arrange that.
Good to know. But it's great for us to know these things as well. Annette, really quickly, because we have car share to do.
My question was, it says that you do non-medical transport. Is there a link or something you could send to us to clarify when that might be applicable with this service?
Yep, it is on the website as well, information about non-medical transport. It is for only particular waiver groups, so they have to have that type of eligibility through Health First Colorado if they contact us. But the only piece of that we handle is for public transit. So if they are utilizing public transit, they would contact us for a non-medical transportation. And we would issue the ticket, but they do make those arrangements through their case manager, through their waiver program. And that is what shows to us that they are eligible, and then we issue those public transit tickets. If they require commercial transport outside of public transit, like a wheelchair lift vehicle or something like that, they do work through their case manager for that piece of it. We only handle issuing the tickets for non-medical.
Okay, and then I'm assuming there's like a cap on the amount that would be paid,
Yes,
just
ma'am.
like the RTD
That is all
stuff.
determined by Health First Colorado, by their case manager. And then we see that information as well. So we know how many trips per month and such that they are
Okay.
able to utilize.
So it'd just be a way to cover the cost, even if they have Access-a-Ride, they could just get
Correct, ma'am.
a
Yes,
fare
ma'am.
ticket.
Yep.
Okay,
And
thank you.
we would just, Medicaid would be covering the cost of the ticket. And there are some members that we send monthly passes to because they are dialysis perhaps, or methadone clinic transportation under the medical side. So we weigh it against, if they have more trips, that individual tickets would cost more, than obviously we send a monthly pass for that.
And so then this would need to be written in their service plan for units applied to transportation?
For non-medical, yes, ma'am.
Okay, all right, thank you.
Any other questions? Great, and I'm sure that you can reach out to Kimberly, or if there's any specific things that you're having problems, or the website.
Yes, Josh did share that in Telluride email address, and him and I both manage that on a daily basis. So yes, any questions you might have, if you have a unique situation with a member and want to know what we might be able to do to help, that would be the way to reach out.
Great. Thank you so much.
Yes, thank you.
And we're gonna jump to Bobby. Car share.
Hi all. Hi, Tom.
Hi there.
Good to see my favorite Netherland member. Let me get my screen going here. There we go. Oops, that is not it. Hold on, sorry.
We have a nicer car than that.
Exactly. I don't know why this is showing. What are you guys seeing?
Drive inclusive sustainable mobility.
Oh, okay, great. Perfect. I thought I was seeing something else. So, okay, great. So, okay. Thanks for having me. My name is Bobby Solis. I am with Colorado Car Share. I just want to give you a brief overview of what Colorado Car Share has been up to, and how it aligns with some of the work that you guys are all doing. Okay, it's not. There we go. Are you still seeing that? Was the screen updated? Okay, great, because I can't see what I'm presenting. So, okay, so we are 25 years old. Colorado Car Share is. It started out as Little Red Car, and then it moved to Ego Car Share, and it's been rebranded, and so now it's Colorado Car Share. And you know it's our car when you see that little infinity logo on it. Our mission is you know, as you can read on the screen, but it basically, we want to create independence and have reliable transportation for everyone to use. And we make them pretty easy for the members to use. And we do have a two-prong approach that we want the education and outreach, and try to get rid of the single occupancy vehicle, and let people, you know, have one car in their household or no cars in their household. But definitely we want to create some independence for the reliable transportation. We we want to have a significant impact on the community, both on education and outreach. Our biggest challenge right now is just educating people on how to give up their car and use car share, and understand that car sharing does work, and it has worked, and we are growing really fast in the Denver area right now, and we just can't get enough cars out there on the road, and we're looking for more places to park our EVs. And so there you go. So we have 4,000 members right now. We have 75 vehicles in Colorado available for any member of Colorado Car Share. With our cars, you can book 24 hours a day, 7 days a week, as little as 15 minutes up to a week, even longer if need be. We have different options, and it is a round trip model. You pick up wherever you pick up the car, that's where you drop it off. Then most of our, well, all of our spots have the sign that we have paid for or arranged to have our car parked there. And we just have to have that so that our members know where the car is going to be or in that area, because sometimes our spots do get taken. And let's see here. It's really easy to join Car Share. You just log on to our website, and I have QR codes on most of our slides if anyone wants to do that. And then I also did put in the chat the information, but basically what you do is you will apply. You can sign up on the website. We need a valid driver's license with 2 years of good drive history. We need a valid credit card so you can pay for your booking. And we need your physical address and an email address, and obviously an emergency contact. And then we have different options to choose from. We do also have additional insurance, and that comes with it, but we have additional insurance if you want to pay $8 a month, and this waives if you back into a pole or like the red card that you see on this screen, they rear-ended someone. They did have the damage waiver, so they did not have to pay for anything during that accident. So that's really, really, I highly recommend getting that damage waiver. Okay, so we have the 3 plans. We actually do have 4 plans to choose from, but I'm just going to talk about the 3 plans that we have. And it basically goes on the need of what you want to do, what suits you. Sometimes if you're only going to drive 5, 1 day a week, it just depends on your need. And on the website, there is a quiz on, what will work best for you based on your driving. Okay. And once you do get approved, then there's 2 options. Usually what we'll do is we will mail you the new member, the new member quick guide, which everyone sees this. And on that, it has all kinds of little tips and tricks on how to get the car. We do have some members that still do have the fob, and they both work just as well. You just hold it up to the window and you can get in. So these are the different locations of where all the cars are, and they're updated all the time because we just put a new one in Boulder and Fraser Meadows, and we do have 3 locations in Breckenridge, 1 in Dillon, Frisco, and Nederland, of course. And once you do become a member and you get approved, you download the app, and then that'll find the car that's nearest to you, and it'll tell you the available time that you can have the car. As you can see right here, that has the times that car is available, and you just book it. And then once it's booked, you can actually see where the car is live, but in Nederland, you won't really have the problem that we have in Denver. And then you get you just confirm that it's booked, and here's the booking confirmation that you'll get. And then you get the booking confirmation. And now with our app, you actually will, if you choose to receive notifications, they'll tell you that you'll get a notification when your booking is in 15 minutes, and then when your booking is about to end in 15 minutes. So this will eliminate any late fees. And the late fees are $1 a minute. So we highly recommend you are on time, and you do have the availability, if the car is not booked, to extend your booking. And this is how you get into the car, and you just hold your reader up and you fob in, and there you go. And just you can drive in any weather. If it is really bad weather, we do book the cars out so no one can drive it. And if you are a really nice member and you do not have the car booked, but you do scrape off the snow, you take a picture before and after, and we give you a Snow Angel credit of $10. And any credit that we put on your account, it always goes towards your drive credits. And that is Will. He's one of my favorite people that works at the Boulder Chamber. And then when you get out of the car, we ask you take all your belongings and you make sure all the doors are closed, and you fob out every single time. And because of it's an EV in Nederland, the way it would work is you would actually have a card, a ChargePoint card, and before you lock the door, you swipe the power station, and it'll release the cord. You plug it into the car, return the RFID card to the car, and then you fob out. It sounds like a lot of work, but once you get into it, it's pretty simple. And
yeah, Bobby, I've probably driven this car more than anybody. So Bobby and I talked about this. If anybody wants to go for a test drive, I'll take you out.
Yeah.
It's a great, it's a Subaru Solterra. Even when we had our multi-feet of snow, that car just plows right through it, which is unusual for an electric vehicle.
Yeah, they're nice and heavy, and we do keep snow tires on our cars, or all-weather tires. It depends on the location of the car. And I don't know, does that one have ski racks, Tom? I don't remember.
No, it's got a rack, but no ski rack.
Oh, okay. All right. So anyway, so we are what slide is this here? Yep. So, okay, so we're just providing the transportation for everybody, and you can see we do have quite a few EVs on the road, and we do have other cars to choose from. But in Nederland, we do have the grant to have the car there, and which is the Solterra, and we are committed to keep the car there. If there is a safety issue with the car, we will pull it and get it taken care of and return it right away. In some cases, we do put another car there. It just depends on how popular that location is. And anyone that lives in Nederland can join, and normally the application fee is $25 to join. And but the application fee would be waived if you use this promo code, and then you'll also get $25 in drive credits, which that's pretty good, because that's it's a couple hours, 3 hours, depending on the price plan that you choose. And that's it. Here's a picture of my dog just to lighten things up.
Very appropriate for Nederland.
For those of us up in the mountains, a couple things about the car. It's parked over near Town Hall. The Colorado Car Share has these things sprinkled near RTD points, which is extremely helpful. So if I need a pickup truck, I go down to Table Mesa and Broadway. There's a pickup there. So there's really vehicles suitable for anything that you need to do. Positioned strategically.
Yeah, and if you happen to be in Boulder and you are a member, you can book any of the cars there while you're standing at the car. If it's available, you can book it right then and there, as little as 15 minutes up to a week, even longer, just depends. And we do have affordability options. So if you live in affordable housing, you can just show us proof, just email us a copy of the lease, and we can put you on the least expensive plan, which for that car would be about $5.44 an hour.
Looks like Colleen has a question.
Oh, there. So
I figured out how to raise my hand. Bobby, I have a question, just because there's several different agencies, like EFA and the Boulder County Area Agency on Aging. I know that the food bank has some funds. Is it possible for organizations to pay ahead and put credit on someone's account so that in any way so that they can use the car service if they don't have the funds to do so?
Yeah, we actually we did actually work with a victims advocate for one person. It ended up not working out the best, but yeah, we can definitely do that. The only challenge is the zip code thing, but we can always figure a way around that.
I did find in signing up for it, and that it's an option for people who have credit cards and money. It wasn't necessarily cheap because we have to drive 20 miles to get anywhere. So, and then a monthly fee, because you never know. Some people don't know, like for me, if I do I think I signed up for the Peace of Mind, which I thought was free every month. And I saw on there that it charges every month.
So if you've already signed up, the Peace of Mind is still free. Starting July 1st, we are raising it to $4 just to cover our costs.
So yeah, so that doesn't, that's even $4 can be a burden. And then the technology issues that we have up here. So I think it's great for people, if you need to help somebody, if you can. Anyway, what I'm saying is I love the program, but we have to maybe work some workarounds to be flexible if we're going to actually have it for service providers and things.
Okay. Yeah.
For those kinds of trips, you know what I mean? Just because, again, when I went to look at the costs of things, it was a lot for me.
Yeah.
To do it. So for me, it's just an emergency thing.
Yeah. And so like I said, we do have the Peace of Mind, or I'm sorry, the Free Willing plan that is free every month. And it's you just have to just send us proof of your affordable housing or SSI or food stamps or what have you, or if you're on any type of assistance, then we can give you the lowest rate that we have for free, and it would be $5.44, I think is what I thought, $5.44 an hour to use that car, and then 30 cents a mile, which is still much less expensive than owning a car.
Yes.
That's a quick
Oh, yeah.
question here, really quick. That brings up a really good point from Katrina, is saying that the technology barriers and issues. Is there any program within your program to be able to hold workshops or teaching courses on how to teach people to teach other people in order to keep the program self-sustainable up here? Is there any way
Yep.
to have that be done?
Yep, I'm always open. I mean, if there's a group of people that want to meet, I'm happy to go up there and explain how it works. And you know, and if there's a farmer's market or something going on, you know, I'm always happy to go up there and do that. I love to talk to the people and help
That's
them.
awesome. That's really awesome to know, because a lot of the barriers I feel up here is that not having people willing to come up to spend time to do it with us up here. And if
Mhm.
you have that one less piece of it, it's one less barrier. You get what, say 5 people, like Tom said, he had a great experience
Yeah.
learning how to do something, and then again it just branches out, right?
Yeah.
It's a trickle effect. It's a domino effect where we can teach each other and eliminate a lot of those barriers and stigmas around technology.
Yeah.
So that's just one more thing. It doesn't always cover the cost, of course, but it's one more thing to put the effort forth.
Oh, yeah, definitely. And it can be intimidating, you know, using the fob and getting in the car and starting it. And, you know, it is intimidating, especially driving an EV, because I know there's, you know, there's some trust issues, you know, about using the EV. But we actually do have one member that's in Denver. She's our car captain because she takes care of the cars. She takes them get washed and things. She is 83. And she takes care of 2 EVs. She moves them, she plugs them in when they don't plug, you know, when someone doesn't plug them in. And
See,
she
there
takes
you go.
care of-
There
Yep,
you go.
so it's just different. And once you get used to it, it's really easy. And it takes less time to plug it in than it does to put gas in it.
Sure. Thank
And
you.
I think one of the biggest barriers for any of these programs is signing up.
Yep.
We just have to be available to people to make sure that they finish the sign up process, that they start it, that they finish it, that they make it through that process.
Yep. And Sarah she's the one that onboards, and she is very diligent about, you know, okay, you're almost done, follow this. And, you know, we have templates that show how to do everything. And it's really easy. And once they get through the painful part of applying for it and doing the online orientation and sending a selfie with your driver's license, it's go time.
Yep. And I think one of the big important things that we have to remember also is that there is that option for the lower income, which I didn't see on there and wasn't aware of. So that could be important going forward.
Yeah.
Yep. Bobby, is Kelowna Car Share a nonprofit?
It is a nonprofit, yes, and we try to keep I just said about the peace of mind. We did have to raise it to $4 because we do have quite a bit of cost. You know, we do have a lot. You know, we do have some vandalism that happens, and the cost of everything is going up, and so we had to raise it to $4 a month. It's not. That one's not too bad, but we still do have the free plan for the people that need, you know, that can, you know, have proof of affordability options that need assistance.
Good. So I was serious. I'll take anybody for a test drive that wants to go. It's a great vehicle, and I want to see it gone more than it's there.
Exactly. Yep.
You're on.
Christine, did you have a question?
It's kind of personal. I live over in Coal Creek Canyon. I can't walk over to the EV. I would need to drive to the EV. So I'm curious about how you help people evaluate whether a car share right for you.
So actually, you know, you can go to our website, and there is, you know, there's the list of questions, but if, you know, if there's any type of concern about the reliability of your vehicle, then definitely it is a great option for you, especially you don't have to pay for gas. And yes, you do have to pay for the time and the miles, but it is still less than what a car would be. And it's better for the environment, as far as
Yeah.
the fumes.
That's what speaks to me.
Yeah. And then we do, because we do have the RFID card in the car, if you are taking it for a long trip, any charge point station will accept that card. And it's no cost to you.
Great.
Thank you.
Okay, any other questions?
Reba had asked if you could give us a number of people who use it in NED,
Oh,
or
actually,
the users.
I just pulled it up. It looks like we have, in that area, we have about 70 people who have signed up. The most recent is probably, so I did a 10-mile radius and we do have 70. Yeah, we do. Yeah, I did a 10-mile radius, and I'm sure if I did more, it'd be more, but it's about 70 people in that area. But I
Have
think
signed
there
up.
is I'm sorry?
Have signed up, not necessarily used it.
Correct. Yeah. And then, but some of the members actually they may have already been a member. So I can't really tell how many new
From
members.
this program, right? Yeah.
Yeah. But they're members that do live in Netherland, but they might ride the bus down and use it in a car in Boulder. Any other questions?
Thank you.
Any other questions for me before we go? Thanks again, everybody, for coming. Really appreciate everybody's time, especially those who stayed to the very end.
Thanks for putting it together, Katrina.
Yeah.
Well,
Always
thank
learn
you,
something.
Jessica. I mean, it was.
Yeah, thank you, Jessica.
We have
It was
to,
a team effort.
yeah, we have to get the message out, but we'll get there. It's good
Thanks.
stuff.
Thank you. Have a good day. Thanks, Katrina.
Thanks, everybody.
Everybody.